There is something they can do for total occlusive disease, and that needs to be common knowledge.
One of the best parts of interviewing Dr. Michael Kennedy, who practiced medicine for decades before becoming a professor here at KU Med, is when you ask a question, Dr. Kennedy makes sure you understand the answer.
How would you explain to someone like me without any medical degree, what did they do to fix your heart?
So you know me, the teacher, I want to draw a heart.
You can draw.
The heart has a big pumping chamber called the LV, and then the right ventricle.
But before we get to the solution he's so happy about, we need to go through one of the saddest moments of Dr. Kennedy's life.
It was kind of dismal, it was a depressing appointment. I'm sorry, I don't mean to get emotional, but it was essentially kind of a downward progress, kind of get your affairs in order.
It was August of 2022, 18 months after Dr. Kennedy had survived a heart attack and triple bypass surgery, and he had gone back to the doctor. After a stress test and heart catheterization, doctors discovered something, and it wasn't good. A chronic total occlusion, also known as a CTO. Plaque had built up, causing a total blockage in his coronary artery. Dr. Kennedy and his wife were reeling. Having just retired from practicing medicine, he was ready for his next adventure, which included teaching medicine, spending time with his huge family, and traveling with his beloved wife.
My wife and I were high school sweethearts.
And now this? How could it end this way? A few days later, the phone rang. It was his doctor again, who had spoken to another doctor who happens to specialize in treating CTOs.
He reviewed your case and he thinks he can help. So I was, the emotional roller coaster.
And that's how Dr. Michael Kennedy came to see the University of Kansas Health System cardiologist, Dr. Tony Spaedy. And Dr. Spaedy could not have been more reassuring and comforting.
It didn't take a minute to say, this is a no-brainer. So he did a balloon procedure. And so in order to do that, you have to be able to pass a wire through the blocked area.
An hour after the procedure,
I was ready to leave right then.
They made him stay the night, but Dr. Kennedy was a new person. And that next morning, he walked out of the hospital and into those next adventures he'd been dreaming of having.